Okay, so y'all remember your anatomical position. Okay, this is another one of those. Going back in time, right? Remember your anatomical position, right? Okay, and then you remember the different paired terms where you have superior, inferior, anterior, posterior, medial, lateral, all that kind of stuff. And then you have the different planes. And then this is going to be important when we talk about range of motion, because we'll talk about different planes. When we talk about range of motion in ONE2 or in this class, you talk about there's 3 different P's that are involved in range of motion. You have the planes. So what are the 3 main planes in the body? What's this one here? Okay, sagittal means arrow, so it's like you shoot an arrow straight through. So that's dividing the body between right and left. Okay, then what's the other one? Frontal or coronal, so that's where you divide the body into back and front, or anterior and posterior. And then transverse. Okay? Transverse divides between the superior and inferior. And then in each of those planes you have 2 paired motions. So the first piece for plane, the second one's for paired motion. So in the sagittal plane, what do you have? Flexion extension. Okay. And then in the frontal plane, what do you have? Abduction, adduction. And then in the transverse? And that's what they were doing in the first video, where they're doing the twist, right? And then there can be more detailed movements that you talk about in those different planes. Remember on that other dance where the guy was doing this kind of thing? Right? Okay. Do you remember what the name for that is? What's that? Somebody said something? We'll get to it. There's some stuff in here we'll talk about. And then you have the different axes. And that's basically what the axis where the movement occurs on. Okay. So you can have a transverse axis, which is, that's when in the sagittal plane, when you have flexion extension, it occurs on a transverse axis. Okay? And so then you have different axes. So then we talk about joint movement. So again, in the sagittal plane, you have 2 paired movements. And what's that going to be? Flexion extension, or sometimes we talk about hyperextension. And then in the frontal plane, you have abduction, adduction, or if you're talking about on the spine, then you're going to have lateral flexion. Also, you can have elevation and depression. And then you can have radial and ulnar deviation. And then inversion and eversion. So if you're talking about the ankle, if this was my foot, this would be inversion turning in and eversion turning out. So again, those are all different things that occur in the frontal plane. And then transverse, you can have internal rotation, also called medial rotation, and then external or lateral rotation. And then in the spine, you just have right rotation, left rotation. And then also you can have pronation and supination. Okay, so when I do this, I'm doing 2 things. One is happening at the shoulder, one's happening at the elbow. So I'm doing internal rotation, but I'm also doing pronation. So pronation and supination occurs at the elbow, but it's in the transverse plane. Same thing as internal, external rotation in the shoulder. And then there's other specific terms where you talk about horizontal abduction and adduction. Okay, so usually adduction is like this and abduction is like that, but when you do it in the horizontal plane, then this is horizontal adduction, horizontal abduction. So when it comes to the shoulder, there's some different specific terms that we talk about with traditional ranges of motion. Then you can have a more complicated or complex ranges of motion where you talk about circumduction, just like this, where you're moving a joint in the shape of a cone. Then you can also have, in the foot, you have pronation and supination. Pronation is a combination of movements. Okay, what you're going to have is extension, abduction, and dorsiflexion. So it's moving the foot like this. Basically, it's like you're taking the navicular and then driving it down, and then the foot with the breaks of the toes going up like that. So it's turning in like this. Whereas supination is the opposite. So it's inversion, plantar flexion, and adduction. And then you have different categories of joints. What's the most common joint in the body? Synovial diarthrodial joints, joints that move. Okay. Then you have these other ones like synarthrosis, where you have suture joints, and then syndesmosis, where like between the tib and the fib, where there's a joint, but it doesn't really move that much. And then you have amphiarthroses, like a symphysis pubis or synchondrosis. But most commonly, you're going to have diarthrodial joints, and they have different categories of joints. And one of them is sliding, where it's a gliding joint. Okay? And that one, you don't consider that as it's a non-planar joint. It's just gliding. Okay? Then you have a hinge or a bigamous joint, where that's a single plane joint, where it just moves in one plane. So we're talking about here, this is in the sagittal plane, flexion extension. Okay? The elbow doesn't move in any other planes. It just goes flexion extension like this. And then also in the interphalangeal joints, that's strictly a hinge joint. Okay? That's just one plane of motion. And then also another single plane joint is a pivot, up here at the radial head, or also between the atlas and the axis, where you rotate like that. Okay, and then you have condyloid, where that's like basically you have two bowls that slip into each other. You can have moving in one plane and then another plane. So this is a double plane joint, which is different than the hinge joint or the pivot joint. Those are only in one plane. And now you're talking about the wrist. I can move in this plane, and I can move in this plane like this. And then you have a saddle joint. Okay? So saddle, it's like if you look at a saddle on a horse, it has two different curves to it. From front to back, it curves this way. From side to side, it curves like this. So that's going to be here at your thumb. So that's what gives you an opposing thumb. Versus your fingers, all they can do is go back and forth like this. I mean, this joint has two planes of motion, but the fingers only go like this, whereas the thumb has more motion. And then you have a ball and socket joint, where that's a multi-plane joint. So there you can do circumduction, because you can do flexion extension, abduction, adduction, and then internal external rotation. So there's movement in 3 different planes for that, for ball and socket. And then we'll go through the different major joints in the body, and then I can bring this up here. At this point, some of the people, I've passed this out during the midterm. If you don't know what this is yet, it's basically, these are the different projects that you're going to sign up for. Typically, it's going to be 2 people per group. Some people still just have one. If you want to partner up with somebody, that's fine. But the idea is you're going to have 2 people, and then you have one of these sheets which basically tells you what you're going to be talking about. So you're going to give a presentation up here and have a written handout where you're going to go through. It's basically like you're telling the story about the different condition. Who gets it? What happens? How does it happen? Where does it happen?